Hi, I'm Dr. Lee.
Hello everybody, I'm Dr. Chai.
Hi, I'm Dr. Wong.
Hello everybody, I am the skeleton.
The topic today we are going to talk about is
Lungs emphysema.
Before that, I will use this lung model to introduce our lungs, which is the amazing organs that are working non-stop to keep us alive. We observe the outer shape first. Our lungs are two large, soft and spongy organs that located inside our chest. They are part of respiratory system, which is the system in the body that responsible for taking in the oxygen and getting rid of carbon dioxide. And our lungs, they have a cone-like shape with a pointed apex at the top and a broad base at the bottom, resting on the diaphragm. So now, let's take a closer look and go deeper into the anatomy of the lungs. First, at the top, we have the trachea, also known as the windpipe. It is the main airway that brings the air from our nose and mouth down into the chest. The trachea will then split into two main branches called bronchi, which is inside here. This is the right bronchus and this is the left bronchus. These bronchi will carry air into each lung. Now let's label the lung themselves. This side is right lung. It has three lobes. The first lobe at the upper one is superior lobe, and the center one is the middle lobe, which cover the bronchioles, and the bottom one is inferior lobe. And this is the left lung, which have two lobes. The upper one is superior lobe and the bottom one is inferior lobe. All of these lobes are separated through a gap called fissure. So now, you might wonder why the right lung is bigger than the left lung. So the heart is the reason. It is because the left lung needs to make space for the heart. It even have a small indentation here called cardiac notch. It is designed to accommodate the heart's position. As we go deeper into the lungs, each bronchus branches into smaller and smaller tubes here, which is called bronchioles. It is kind of like three branches spreading out through the lungs. These bronchioles eventually lead to tiny balloon-like air sacs, which is called alveoli. This is the alveoli. And this is where the real magic of breathing happens. Surrounding the alveoli, there are tiny blood vessels called capillaries. Due to the capillaries, the oxygen able to enter the blood vessels from the alveolus and the carbon dioxide is removed. So this is the site of gas exchange. And finally, let's not forget about protection. Look at this picture. Each lung is wrapped in a pleural membrane made of two layers. The visceral pleura is the inner layer that sticks directly to the lungs, and the parietal pleura is the outer layer lining the chest wall and diaphragm. Between this layer is the pleural cavity filled with fluid to reduce the friction during breathing. This is all about the anatomy of the lungs. But let's quickly recap the labor parts. At the top, this is the trachea, the main airway. And inside there is a right and left bronchi, which is the air tubes into each lung. This is the right lung with three lobes. This is the left lung with two lobes and the cardiac notch. And here is the bronchioles, the smaller branches inside the lungs. And this one is the alveoli, the air sacs for gas exchange. Surround the alveoli, there is a tiny blood vessels for oxygen and carbon dioxide transport. And the last one is pleural membrane. which is a protective double layer with fluid.
Next, let us look about how lungs function. The lungs are vital organs in our respiratory system that help us breathe by exchanging oxygen and carbon dioxide with the environment. When we inhale, air travels through the nose or mouth, pass down the trachea and enter to the lung through bronchi, which branch into smaller bronchiole ending in alveoli. The alveolar walls are very tiny and surrounded by capillaries that are tiny blood vessels allow gases to move between the air and the bloodstream. Oxygen in the inhaled air diffuses across the alveolar membranes into the blood, where it binds to the hemoglobin in the red blood cells. At the same time, carbon dioxide is the waste product of cellular respiration moved from the blood into the alveoli to be exhaled. This process of gases exchange is driven by simple diffusion based on the difference in gas concentration between the alveoli and the blood. Breathing is also controlled by the diaphragm and intercostal muscles. This process involves two main phases, inhalation and exhalation. During inhalation, the external intercostal muscle contracts while the internal intercostal muscle relax. This causes the ribcage to move upward and outward. At the same time, the diaphragm contracts and flattens, moving downward. This combined action increases the volume of thoracic cavity and decreases the air pressure inside the lungs. As a result, the higher atmospheric pressure outside the body pushes the air into lungs, filling them with oxygen. In exhalation, the process reverses. The external intercostal muscle relaxes and the internal intercostal muscle contracts, pulling down the ribcage downward and inward. The diaphragm muscle also relaxes and diaphragm curves upward, returning it to the dome-shaped position. This reduces the volume of thoracic cavity and increases the pressure inside the lungs, causing air to be pushed out of the lungs.
Now, let us back to the topic. What is emphysema? Emphysema is a chronic lung disease that is included in the chronic obstructive pulmonary disease (COPD). It primarily affects the alveoli, the tiny air sacs in the lungs where gas exchange occurs. In emphysema, the walls of the alveoli are damaged and eventually destroyed, reducing the surface area available for oxygen and carbon dioxide exchange. As a result, the lungs become less elastic, making it more difficult for someone to exhale completely. As the disease progresses, several noticeable signs and effects appear. One of the earliest and most common symptoms is shortness of breath, especially during physical activity. Many individuals also experience wheezing, a whistling or squeaky sound when breathing, caused by narrowed airways. Another key symptom is long-term cough that doesn't go away due to chronic irritation of the respiratory tract. As the disease progresses, fatigue becomes more noticeable due to reduced oxygen levels in the blood. People with emphysema often produce increased amounts of mucus, sometimes with a yellow or green color, indicating inflammation or infection. Now, let's take a look at the main causes of emphysema. The underlying factors that lead to this progressive lung disease. The most common and significant cause of emphysema is cigarette smoking. According to the Mayo Clinic, up to 85 to 90% of emphysema cases are linked to smoking. The harmful chemicals found in cigarette smoke, such as tar and carbon monoxide, damage the alveolar walls, reduce lung elasticity, and trigger chronic inflammation. Over time, this damage leads to the breakdown of lung tissues and impairs the lung's ability to function effectively. Another major contributor is long-term exposure to air pollutants, including dust, chemical fumes, and industrial smoke. People who work in environments like mining, construction, or manufacturing, especially without proper ventilation, are at greater risk. Inhaling these harmful particles causes chronic airway inflammation and oxidative stress, which damage alveoli and promotes mucus buildup. This narrows the airways and gradually destroys lung tissue. In some cases, emphysema can also be caused by a genetic disorder known as alpha-1 antitrypsin deficiency or AATD. Alpha-1 antitrypsin is a protein that protects the lungs from an enzyme called neutrophil elastase, which breaks down old or damaged cells. People with AATD inherit mutated genes that result in low or absent levels of this protective protein. Without it, healthy alveoli are vulnerable to damage, even in the absence of smoking or environmental pollutants. Although these cases are rare, this form of emphysema can appear at a much younger age.
Now that we understand the causes, let's explore the consequences of emphysema. How this disease affects the lungs and the rest of the body over time. As emphysema progresses, the alveoli continue to break down, and the lungs lose their ability to expand and contract effectively. This leads to trapped air in the lungs, making it difficult to fully exhale and causing chronic shortness of breath. Over time, even simple tasks like walking or climbing stairs can feel exhausting. Another serious consequence is the loss of oxygen exchange efficiency. As the surface area of the alveoli decreases, less oxygen reaches the bloodstream and carbon dioxide builds up. This oxygen shortage can result in cyanosis, which appears as blue lips or new veins, and contributes to constant fatigue and weakness. In many cases, emphysema also increases the risk of frequent lung infection, such as pneumonia and bronchitis, because the damaged lungs have trouble clearing out mucus and bacteria. Additionally, long-term strain on the lungs can affect the heart, leading to complications such as pulmonary hypertension or right-sided heart failure. Well, emphysema is a chronic and irreversible condition. There are several treatments available to help manage symptoms, improve quality of life, and slow the progression of the disease. The most important step in treatment is quitting smoking. This is crucial because smoking is the leading cause of emphysema, and stopping it helps prevent further lung damage. Even if the lungs are already affected, quitting can greatly reduce complications. Doctors often prescribe bronchodilators, which are medications that relax the muscles around the airways. These help to open up the air passages, making it easier to breathe. In more advanced cases, inhaled corticosteroids may be used to reduce airway inflammation. Many people with emphysema also benefit from oxygen therapy, especially if their blood oxygen levels are too low. Using oxygen at home or during activities can relieve breathlessness and support vital organs. In very severe cases, when other treatments no longer work, options like lung volume reduction surgery or lung transplants may be considered. These are rare but can offer improved breathing for people with advanced care.
So now we know emphysema is a serious lung disease that affects how we breathe and how much oxygen our body gets.
Thanks for watching our video. Breathe easy, stay informed, and take care of your lungs.